this problem. I had a family member that I had to put in a drug rehab center. I've been there, done that. And it actually worked. He grew up and he is now a very productive citizen in California working for the state. But that was a very long year, let me tell you. I think that we need to recognize that there are several aspects to fixing this. One of them is to understand the role of treatment as compared to incarceration. I think treatment is a far better solution in most cases than incarceration. Treatment is lengthy, however, and it's very expensive. And so we need to get both the federal and the state government involved in doing it. I have a specific idea for the 6th District. That's to take the old Fort Ritchie, with which I'm very familiar. It used to be called Site R back in my days in the Pentagon. And there are still buildings there. There are still adequate facilities there, and I believe that should be transformed into a rehab center. It can be done without a lot of funding. What it will really take, however, is commitment and the resources to get the right people to manage it, and I will work on that. On the other hand, we also need to look at the source problem. I think we need to have a much better control of the prescription of opioids in particular. I think they are clearly oversubscribed or overprescribed by a lot of doctors. I had a conversation with several doctors the other day about how we can handle that, and one of the ways is to revise the medical protocols for this. Right now, it is based very much on personal views of how much pain you're suffering, and we need to have a slightly more objective way of addressing that. The doctors prescribe X amount of opioid pain medication under specific circumstances, and we need to have that reviewed, and we also need to have it monitored, which can be done today with the new technology, to stop people from doctor shopping and going to multiple doctors to get multiple prescriptions. This will both cut down on individual addicts, and it will cut down on the available stuff on the streets. So those are the approaches that I would take. Thank you.
Sure. But I agree with a lot of the things that Ami just said. I mean, I think we have to take a step back. Obviously, what's causing a lot of this is economic distress, the breakdown of communities, and the breakdown of families in a lot of ways, right? And those are interrelated, right? So unless we really actually revive the economy in a more broad-based way, we're going to continue to have issues like this. The second issue is how we think about it as the healthcare crisis and mental health care crisis that it really is. The mental health care system in this country is completely broken, right? There's been some reforms put forth in Congress, of which I'm supportive of. That's a whole other discussion, but it's related to this. There's a lot of specific issues around trying to get at the issues with what's going on with pharmaceutical companies. And let's face it, the pharmaceutical companies in this country have run a little roughshod on our citizens in a lot of different ways. Right? We look at what's happened with this EpiPen, which my wife carries around. I mean, it's just staggering what they've done on some of this stuff. At a minimum, we should be letting the United States government negotiate with pharmaceutical companies to get the best deal. The fact that the largest buyer of drugs can't negotiate with them, right, just shows the power that they have, which is not good. I mean, there's no place in the United States of America, which is a capitalistic free market system, which I obviously fully support, where the largest buyer can't negotiate a deal. We're not allowed to do that. So that shows the power they have. So they've, you know, I wouldn't say they're certainly not behind any of this, but we just need to make sure that they're not overly pushing prescriptions of these medications. We need to do better things around tracking how many prescriptions someone has, making sure there's more transparency around some of these prescriptions so that people know that they're being done. But then finally, in terms of treatment, there's a tremendous number of programs, many of which are small, many of which are community-based, religious-based, that have been very successful at treating patients because it's very personal, right? They really get involved in their lives. It's not a big bureaucracy. And they're doing innovative things, like connecting to experts using teleconferences. Someone can actually really access someone at Hopkins if they need to do a specific treatment on an individual, so the local provider is actually using telemedicine to get the kind of expertise you need. And I think that's one of the reasons I've been involved in these kind of public-private partnerships. Social impact bonds pay for success, which is really getting more money, a mix of government money and private money, in the hands of operators that are kind of small, nimble, and community-based. Because I think they can be very successful at managing, and they need to be empowered and have more